Welcome to the Whole Health Podcast,
where a functional nutritionist and a biological dentist investigate the interconnectedness of your health.
Let's get started. We're back for another episode of the Whole Health Podcast. And I always love our podcasts that are just you and me so we can dive into all the nerdy stuff that we're excited about. So that's what we're going to do today. And we're going to dive into biological dentistry and really examine what it is, what it means, and how somebody would be able to identify a provider's skill set in the world of biological dentistry. So this is all you. So tell us.
Sweet. Well, and I know we're on a little bit of a time constraint. So for our listeners today, this will be a shorter one based on some time constraints we have today. But great question. Biological dentistry. If we go back 40 years when the International Academy of Biological Dentistry and Medicine first formed, I think that the people who were involved in that, some of whom I've met, it's all the best intentions. The idea is, can we provide care that is more synergistic with human health rather than contrary to it?
Okay.
So for instance, it would not be a biologically compatible thing to put, known neurotoxins such as mercury, right in your mouth where you're going to breathe it in, you're going to swallow it, it's going to be inches from your brain. So similarly, generally speaking, let's say root canal therapy, leaving a dead organ behind in your body. Not to say that it's bad in and of itself. I mean, there are some benefits to root canal therapy and what it does for a tooth. However, nothing's all good or all bad. It's going to present health risks. So that's really the movement of biological dentistry, is to look at what kind of care can we provide that helps to optimize the level of health for the human beings that we're serving. So that's kind of where my understanding is that it started. I mean, that wasn't certainly, I wasn't trained in a biologically respectful manner necessarily in traditional dental school, although I will say it's a great education, good place to start. It's really my movement into this space of the biological realm. Of the 26 years I've been in practice, probably the last 10 to 11 years, that's been my focus, is taking a good look at instead of root canals and putting numerous different dissimilar metals in people's heads, one, should I acknowledge that those things would have an impact on somebody's health potentially, and consider something that might be more congruent with health or not throw the body off balance?
Okay.
Yeah. So the trick these days, fast forward into 2025 here, I have seen throughout my career the term du jour change in terms of what's popular. I'm sure the same thing's true in nutrition, right?
Absolutely.
Like this is the omega-3s.
Absolutely. Right? Yes, we have a new nutrition trend every day.
Certainly. Mm-hmm. So in dentistry, the popular terms, I would say, in the last 5 years have really focused on holistic, biological, integrative, and functional. And in and of themselves, those terms aren't bad. They can be helpful. The challenge for the consumer is trying to understand, what does it mean for each practice? So sadly, it has been my experience to see a number of people where they come to me, like I'm thinking of one patient in particular who was just in my office yesterday. She came to my practice probably 3.5 years ago with a goal of removing the mercury fillings in her mouth.
Okay.
And we provided, all the evidence, photographs, x-rays, talked about her, the fact that this is based on her goals for her health. And she got her estimate, financial estimate. And she's like, oh, this is just, it's too expensive for me. I'm going to seek other options. So she then did, and went to a dentist who claims to be biological, and I don't want to overstate this, but literally the provider is acting like a sheep or a wolf in sheep's clothing. So they're doing the exact same type of abusive care to teeth, like when we're reducing a tooth for a crown, for instance, that has no more than a bite surface, mercury filling. In my opinion, that is abuse of a tooth. If you don't have any proof that it's fractured otherwise, and you just, well, it's an old filling, I see a little crack line in the enamel, it quote unquote needs a crown. I mean, that's what people are told. What ends up happening for a lot of these people, and this is what happened for her, was the tooth gets stripped of all its enamel. They put a crown on the tooth. The nerves are now fried because of all the heat and friction that's created when you grind on a tooth. And now the tooth died. Now she's going to lose the tooth and is considering replacing it with an implant, right? Which in my hands would have been no more than taking out the mercury filling, putting in a new filling, literally thinking about that tooth in its own uniqueness. So to me, that when I think of being truly biologically respectful, I'm thinking of every clinical encounter as a new, unique experience. I have no idea what's going on inside of a tooth that has a mercury filling until I remove the filling and clean it up and document it photographically.
Right.
So in my opinion, and granted, that's all I can share is my own opinion, that's appropriate. Now, there may be a fracture. We may have to remove part of the tooth because the tooth dictates it.
Right.
But not because it's like, well, we were taught in dental school how to spin a burr and, we get reimbursed highly for crowns better than fillings, so we're going to do that and destroy teeth. So the challenge for, human beings seeking care, of course, is how do you differentiate? I think those who are probably more in tune with their intuitive self might think to themselves like, I can see it on the x-ray. It's not a very big filling. How is it how do we get from there to, grinding my tooth down to a nub and sticking, a zirconia cap on it? My opinion is it would behoove you to ask, is that absolutely necessary? And what are my other options? I think in an ideal biological, holistic, integrative, functional practice that we put it on ourselves to offer the information that, well, here are the options. We actually provide them not just x-ray information, because that can be hard to understand as a layperson, but photographs. And I'm not talking about like zooming in on a quarter of a tooth where you have no context. I'm talking about like a full arch view where you can see, oh, that's my entire arch of teeth. So you become part of the conversation and can, to say informed consent, we just use that term and we sign those consent forms when we go to care providers without thinking much about it. I think it is worthwhile to slow down and ask the question, am I fully informed? You and I have not had this conversation before, but a few years ago when I was writing one of my Toxic Tuesday posts, it kind of dawned on me, like, what is the actual standard of care to which in most states providers are held as it relates to informed consent? And it was surprising to me to find out that, in fact, providers are not, dentists, physicians, naturopaths, nutritional experts, like, we're not required to give all options. We're only required to give the options of which we are aware and that we offer, or that we believe are appropriate. So again, that makes it so challenging for a consumer to differentiate between what does this mean when somebody's marketing themselves in a certain way. What does that mean? My encouragement is to ask questions.
I was going to say, this is a hard conversation because if you think about informing a patient, okay, just away from the laws of informed consent or the requirements, informing a patient, we have limited tools, each of us as providers, right? You're not going to offer something that isn't within your scope, right? But you do, out of integrity, want to say, you could do this, you could do this, you could do this, right? We can't be held liable for not offering things we don't know about. We can't be held liable for offering things that aren't in our tool belt, right? But I think when we drill down to, that was a pun. So,
thank you.
Sorry. So when we think about this deeply, what we're really saying to the consumer is advocate for yourself, don't be afraid to ask questions. Any provider that's not comfortable with you asking questions, that should raise a red flag, right?
Yeah.
You deserve to be empowered and educated about your health decisions. And so, because I'll be honest with you, biological dentistry, much like in medicine, holistic, integrative, functional, those are words we use in all forms of medicine that are like, what does that mean?
Yeah.
What are we
Somewhat
doing?
nebulous.
But what I find really interesting about what you're saying is there's a concept of less is more, right? Let's not do something to the organ system, to the body, to the structure of the mouth that we don't absolutely have to do. Why would we do that? We have to honor each unique structure, that it's playing a role in the health of the mouth. And we need to be looking at this and saying the punishment needs to fit the crime. Let's not go in with a jackhammer if we don't need to go in with a jackhammer. Or let's do one step and see if taking the crown off or taking the mercury filling off gives us more information. Now we see more in the tooth, right? But that, the fact that you're willing to do that, the fact that you're willing to look step by step by step and honor the patient's experience is one part of this empowering of the patient to be part of their healthcare journey. Mm-hmm. It's hard as a consumer to understand all of the options that are out there and to be able to shop, right? A provider. We don't all have endless resources or time, right? So when you're thinking about, are there any clues if somebody's out there right now and, far, far away from us, maybe even another country, what are they looking for? Just at first glance, is there any tip you can give people?
Yeah. I will say that, we're quite, in my practice, we are quite fortunate. We have one team member who spends the majority of 2 days a week in actual communication with people via Instagram DMs and emails.
Wow.
We have 2 new patient coordinators that is their specific job. And I share this because, we're not a referral service. We run our own business. However, because it's for the good of humankind and frankly, I can see 350 new patients a year. That's my max.
Yeah.
But we get, pinged by thousands every year. So, we do a lot of engagement with other providers who I know personally, who I would go see.
Yeah.
And this goes well beyond dentistry. Heck, how many people have I referred you?
Countless.
What's in it for me is that I know that they will be treated equally as well in your hands as they would in mine. Gosh, I don't know how many times I had gone out to, lunch or tried to, meet nutritional providers, naturopaths, acupuncturists, what have you, until we met finally. And I was like, click, I finally found somebody who is as nerdy and curious as I am to get to the root cause of things. In terms of what does that mean for a consumer and how do they find someone, we're happy to be a resource. I'm throwing that out there, which I know is ridiculous, but we're going to do it because I think it helps people.
Yeah.
Utilizing resources such as the IABDM, International Academy of Biological Dentistry and Medicine, the Holistic Dental Association, the IAOMT, the International Academy of Oral Medicine and Toxicology. Those are all great groups. The college that I went to back in New Jersey in 2018 through 2020, that was an integrative medical dental college. I will say most of the graduates from that, the dental providers who've been exposed to almost every energetic healing modality you could ever consider tend to be more open-minded.
Right.
To your point, about having tools in the toolbox, and partly the advantage it gave to me wasn't that I went and got a, board certification in naturopathic medical dentistry so I can do naturopathy. It's so I better know when to refer.
Yeah.
Because I want to keep being a great dentist. I want to help people resolve issues in their oral health. So yeah, those are some good resources. And what I loved most about what you were talking about there is giving permission or people owning taking on the permission, giving themselves permission to be advocates for their own health and raising their hand when something doesn't feel right. I think that gut sense that we all have experienced in our lives when we know like, something doesn't feel right here. Or to me, some of the trigger warnings are when you hear a provider say, you need fill in the blank, and they tell you nothing else. In my world, that would be, looks like you need a root canal. Oh, you need a crown. You need 3 fillings. And they offer no other information. To me, that is like, okay, time out. Please help me understand why. And please help me understand what are the other options. And then I would encourage people, like, get a second opinion. No matter what you're doing, ACL replacement, what have you. Think about a new nutritional plan. Like, get a second opinion.
Yep.
It can only help. It can't hurt. So that's
I think that's great. I think, that permission as a patient, and this is an overarching problem in medicine from my perspective. Patients are made to feel like they don't get to question the provider. Ugh, that really makes me mad.
Yeah.
It's true. Many of us go to school for a long time. We learn our trade. We are in practice. Please, everybody remember, we are practicing. So hopefully we're better today than we were 5 years ago, and we'll be better in 5 years than we are today. Sorry. But that's just the reality. Sorry, patients today. Yeah. But we are practicing, right? Yeah. And so as a patient, you hold the space. You hold the right. You also hold the responsibility to ask questions and to say, why? Please ask that question, why? Mm-hmm. And then, are there any other alternative options? Mm-hmm. You might not like them, you might not want them, but it will force your provider into a position where they have to disclose or at least think about it. Mm-hmm. And I think that's what we should all be doing. While we are practitioners, we're also patients, and we see this time and time again. We're trying to empower our patients to ask questions and to be part of the dynamic decision-making. But it's not always comfortable to do that. And providers don't always make you feel like that's your right. Mm-hmm. So I like that. I like that as a guidepost for people as they're trying to find, whatever their provider is, whether it's dentist or otherwise.
Yeah. I think as we wrap up here, I think I also want to emphasize that, I can appreciate, because I've heard it from people's mouths, like, oh, what's it matter? It's like a filling. It's a crown. Unfortunately, I spend all my clinical days helping people who got into or consented to care that has now really negatively impacted their health, and they've been suffering typically for a long time. Mm-hmm. What we choose for our health every day matters. Not to say that, like, oh my gosh, if you don't do all things quote unquote perfect, whatever the heck that means, that you're not doing it right. It's all important though. It all has value, and I think nutrition can be one that's just easily overlooked. Like, whatever, it's a bag of chips. It's, a couple Cokes. I'll give it up next week. Or it's, it's just this or that root canal and crown, or titanium implant. And I think we want to acknowledge that it all matters. It all has value. So take the time your body deserves, to have that attention. But thank you for the opportunity to connect on, I guess, what kind of went down the road of, more around dogmatic thinking and such, but also understanding that, like, what's in a word, what's in a phrase, yeah. Not all biological practices or functional or holistic are the same. So, do your due diligence, seek out your resources, and ask questions.
Yeah, I love that. Thanks for filling us all in.
Well, and thank you for filling us in as well. I look forward to our next one together, and thanks to all of our listeners for being a part of the Whole Health Podcast.
Thanks so much for tuning in to the Whole Health Podcast.
If you enjoyed what you heard today, please follow us on social media and wherever you listen to podcasts.
You can find out more about us at thewholehealthpodcast.com.
You can find me on my website, blodgettdentalcare.com.
And you can find me at bioloungepdx.com or learn more about my organic soluble fiber supplement, Fluorosophy, at thinkfluorosophy.com.
We look forward to seeing you next time.